Back on Morningline, thanks for joining us, talking opioid addiction. Overdoses in Tennessee, 3,000 plus people died of opioid addictions, a record-setting number in Tennessee last year. Part of the reason, pandemic perhaps. Dr. Kristopher Kast is with us from Vanderbilt, along with Brian Sullivan, Prevention Alliance, Tennessee. And we have Joe on the horn, waited through the break, so let's take him. And we do have the lines open if you'd like to join in the conversation. You see the number on the screen. Good morning, Joe.
Good morning, Nick.
Hey, what's on your mind?
I just listened to your program this morning. Most of what y'all have been talking about is prescribed opioids, but there's a big illegal market for these opioids, and you can go around any of these so-called homeless camps. You'll find needles laying everywhere. They're homeless, but they're getting money to buy these opioids from illegal sources. Maybe some of us are stealing them. I don't know where they're getting them for sure. But do you have any idea? Somebody that's kin to me is qualified in CPR. She came out of the grocery store last Saturday. There was a guy laying on the ground and a woman hollered, and she went over to see about him. She's a nurse. She says the guy wasn't breathing. He still had the needle stuck in his arm. This was in the parking lot of a chain grocery store. Well, it just so happens that Fire Hall is just a couple of blocks away, and they showed up, and of course the first thing they done was give him some Narcan. But do you have any idea? It don't make the news because they don't want you to know the news, that it cost the city of Nashville for that EMT, that ambulance, to go pick them up. Narcan has gone up about triple what it was to begin with, and it's the people that a lot of these people that's on these opioids with fentanyl in them and stuff like that. It's costing the city and it's costing the state a bunch of money to revive these people, to keep them from dying. And it's not necessarily the doctors that's prescribing them. They're coming from other sources. So the type of people, I mean, last week on the news, there was two people, I think the woman was 19 and the guy was 21, had a 1-year-old baby. And same thing. They shooting up. Yep. Had to call for an ambulance. So it's an epidemic. It's as much of an epidemic as COVID is right now. So.
Yep, it is. I mean, he touches on a lot of points there. Yeah, we see some very sad cases on the news where, the motherly instinct for these parents, and there's a little child there, it just goes out the window. You know that any mother's going to want to care for the child, and they do the Narcan. There was a horrible case 2 weeks ago where an individual was babysitting the father, or the child, did Narcan, did opioid, passed out, fell on the infant. He wakes up, infant's dead, suffocated, because he passed out on. Oh my gosh.
And we absolutely have a responsibility as a civilized society, when somebody is overdosing, to spend that money with the EMT to revive them. And while Dr. Katz is doing his very important work of saving their life and treatment, our organization, the Prevention Alliance of Tennessee, and the 52 coalitions throughout the state, we're going upstream and trying to keep people from falling in the river that are drowning. We're trying to stop addiction before it starts. And he brought up cost. We know that prevention is cost effective. Primary prevention works and it's cost effective for every dollar that the state of Tennessee spends on primary prevention, they save $4.60 on the back end.
Yeah.
So we absolutely have to advocate, and it takes everyone. For people who think it's not in their backyard, it absolutely is already there.
It is there.
It's in your neighborhood.
Yeah, well, I have no doubt about that. So when you say, by the way, cost, how much is Narcan these days? You talk about how you can go in and if you need it, buy it. Is it expensive? I'm not sure what the cost is for a dose.
I received 2 doses for $30 the last time I purchased it a few months ago. And it varies, but that's kind of around what it is. And as far as I know, to the best of my knowledge, the price has decreased.
Okay, going down.
For naloxone.
And that's what I've heard. I'm sorry, I said Narcan, naloxone. Am I confusing those?
So the same drug, naloxone is the generic name of just the substance. Narcan's a brand name.
I got you. And I have seen reports lately where law enforcement will find someone who's dying from an overdose. 1 dose isn't enough.
Yep.
Is that because, as you said, they overdosed on something as powerful as fentanyl, and it's just
Yes.
the Narcan? If you're on a ton of it and you're about to die, they just have to keep giving it to you till it works.
Yes. Yeah. And so if anybody is responding to a scene, they happen to have Narcan because they want to be prepared. You want to just keep giving doses if the person is not responding, and always call EMS even if they wake up, because they can go back into an overdose. The Narcan only is very short acting. The fentanyl can hang around longer. So, and the other reason to call EMS is getting the person to the hospital allows them to begin to have a conversation with somebody like our addiction consult service to begin to talk about treatment and making sure that this event has the possibility of moving them toward recovery.
That's interesting. So once you revive them, it doesn't necessarily mean they're out of the woods.
Correct.
And again, I have sympathy for all these addicts, but sometimes their behavior just rubs me the wrong way. There was a case where someone overdosed on opioids in a courtroom. And they rushed. The nurses got in there, gave him Narcan, and he was revived. And they were like, okay, we got to help you. He just got up and said, nope, I'm out of here, and just left.
Yeah.
Now, he could have just collapsed again outside as the fentanyl's still in his system, right?
Yeah.
And I know you can't force them to, but when you have addicts that are that stubborn, okay, and I know that there are addicts out there too, that at least I guess are smart enough to know I'm abusing this drug and I may need it, that carry their own Narcan with them so that when they're found unconscious, the Narcan's right there ready to be used. I mean, well, how do you understand that line of thinking? Is it just, again, the addiction that's out of control?
Well, and there's a lot of stigma that's associated with it already on these people. When you think about it as a disease, we've been for decades now fighting a war on drugs, and we're losing. We're losing that war, and it's time that we started treating it as the health crisis that it is.
What is the stigma, you think? How would you describe the stigma?
I think because in the 1980s it was marketed as something that was dirty. If you look at the words
and all that,
for drugs, you say I was dirty and now I'm clean. I don't use words like addict even. I say someone who's battling a substance use disorder. There's a lot of language that pinpoints and sort of criticizes someone who's addicted out the gate. And I think we as a society really have some work ahead of us to do to sort of break down that stigma and say, you know what, it's a disease. It's something that someone's battling and they need a safe place to recover from it, and they need to have a place free from shame that they can turn to for help.
And would you say because of that stigma you're talking about, it's a little bit different for people who abuse these types of drugs than, say, someone who's abusing alcohol, isn't it? It's almost as though if he just has a drinking problem, you don't look at it maybe as seriously, and it should. It's an addiction just like anything else, as someone who's addicted to oxycodone. You think they face a more difficult stigma?
Yeah, I mean, you can walk outside right here and walk downtown and see alcohol everywhere, and you can see people drunk and falling off of stools, and it would not exert near the reaction that it would someone who was addicted to not saying that it shouldn't. We need to get those people emergency care, but it's looked at differently. It's looked at as something that's acceptable, whereas these other types of addictions aren't.
Gotcha. On that note, we'll take a break. When we come back, Linda and Ray, we'll get to your phone calls in our final segment right after this. You're very right.